Our group did Therapies Used for PTSD by Caitlin, Emily, Nicole, and Karma. At first, we're just going to start off with a quick video that shows that PTSD affects multiple people and not just certain stereotypes.
PTSD from serving my country. All I want to do is go back to Iraq to feel normal again.
I have PTSD from sexual assault trauma, and I'm worried that because of it, I won't ever be able to have a normal relationship.
I have PTSD and have nightmares every night, so I avoid sleeping as much as possible.
Today I was diagnosed with PTSD. Now I'm feeling more anxious and depressed about it. I'm not looking forward to the stigma that comes along with it.
I live with PTSD from Iraq every day. Nobody knows, they just think I'm antisocial, boring, and a bit strange.
I can't keep a relationship going because of my PTSD. There's gotta be a girl out there who's willing to look past it for me.
I have PTSD, and when people find out, they ask where I served. When I tell them I wasn't in the military, they dismiss it like I'm lying.
I have severe PTSD, but I'm afraid to get a diagnosis. I don't want a label, a handout, or sympathy. I just want help.
I secretly live with post-traumatic stress disorder. I try to act carefree, but I live on alert.
I hate it when my PTSD acts up, and I'm suddenly afraid of everyone.
My trust issues make everything so hard, and I wish I could just forget my past. But my PTSD makes it impossible.
My ex left me because I have PTSD and wouldn't open up about my deployment.
My PTSD makes me feel alone and unwanted, which makes me angry at people.
PTSD has made me a prisoner in my own mind.
I thought my PTSD was getting better, but then the flashback started up again. I'm exhausted.
I have PTSD. My service dog saved my life. He gives me unconditional love and a reason to live.
So PTSD is post-traumatic stress disorder. It is an anxiety disorder that develops in response to traumatic or life-threatening events, such as war, sexual assault, accidents, or natural disasters. Multiple people can get PTSD, such as anyone who is a victim, witnessed, or has been exposed to a life-threatening situation, survivors of a violent attack, such as rape, survivors of an unexpected, dangerous event, such as car accidents, combat veterans or civilians exposed to war, people who have experiences in an unexpected or sudden death of a friend or family member, children who are neglected and or abused. Some risk factors and resilience factors are not everyone who has experienced severe trauma will get PTSD. It only develops in about 1 out of 3 people. Resilience factors can help reduce the risk of the disorder, which is seeking out support from other people, finding support groups after the traumatic event, and developing a positive coping strategy, such as learning from the experience and seeking a therapist. What causes PTSD? There are 4 reasons that men and women, the top 4 reasons that men and women suffer from PTSD are, both of them, number 1 is rape. For men, it's combat exposure, and then for women, it's sexual molestation. Number 3 for men is childhood neglect. Number 3 for women is physical attack. And number 4 for men is childhood physical abuse. And for women, it's being threatened with a weapon.
Okay, so here's a couple of brain scans. This one is a client with PTSD, and that one's a client that does not have PTSD. And on this one, there's a lot more available receptors. Okay, so symptoms of PTSD. In order to confirm a diagnosis of PTSD, symptoms have to occur for a month or longer. Symptoms include re-experiencing the trauma through intrusive, distressing recollections of the event, flashbacks, nightmares, and hallucinations, emotional numbness and avoidance of places, people, and activities that are reminders of the trauma or triggers, increased arousal such as difficulty sleeping and difficulty concentrating, feeling jumpy, anxious, easily irritated and angered, and then negative thoughts and feelings, as well as distorted beliefs about oneself or others, persistent guilt, fear, horror, shame, and decreased interest in activities that were previously seen as enjoyable, and then detachment and isolation from others. So PTSD can occur in children and teens as well as adults. Symptoms vary depending on the type of trauma experienced, the children's or teen's environment, temperament, and their support system, if their support system provides a safe space. So symptoms include avoidance of certain people, places, or activities, bedwetting, sleepwalking, exaggerated startle response, acting out aggressively, self-harm, and acting out sexually for teens. People who are exposed to such events are also at risk for development of major depression, panic disorder, generalized anxiety disorder, and substance abuse. Frequently bodily symptoms and physical illnesses such as hypertension, coronary heart disease, asthma, and chronic pain syndrome have also been associated with PTSD.
Okay, so talking about psychotherapy. Psychotherapy is a main therapy that is used for people who suffer from PTSD, and it has been being used more and more throughout the years. So psychotherapy is just a general term for treating mental health. It's also known as talk therapy, and if it is combined with drug therapy, it can be more beneficial for certain people. Psychotherapy helps a person learn about their condition and their moods, feelings, thoughts, and behaviors. It also helps a person take control of troubling symptoms so they can function better. It also helps a person take control of their life and helps them also learn effective coping skills. And there are different types of psychotherapies, and some of the approaches involved returning the person back, their attention back to the traumatizing situation, event, and everything like that. So even though psychotherapy can be very beneficial for people, there also are some disadvantages. So some benefits with psychotherapy is that it has fewer physiological side effects, and it also offers a treatment for people who don't do well with drug therapy or medications. It's also very beneficial for people to learn immediate coping skills, and it helps them learn and deal with their personal emotions. And then with disadvantages, it typically takes longer than drug therapies, and if the right technique isn't used or the person isn't with the right therapist, it can be more hurtful and harmful than helpful to that person. And it also has disadvantages with therapists can't respond to a crisis immediate, and also a lot of insurance companies don't cover it, so it can be really expensive for people. So talking about different types of psychotherapy, the first one is eye movement desensitization and reprocessing, or known as EMDR. This was specifically designed to treat trauma. So with EMDR, what the client and the therapist will do is that the therapist will have their fingers in front of the client's face and move them back and forth and have the client follow the fingers, and then they'll have them be aware of their emotions and also their bodily sensations and how they're feeling with that. And EMDR uses a patient's own rapid rhythmic eye movements. The eye movements dampen the power of emotionally charged memories of past traumatic events. And this therapy uses measured exposures to traumatic events with altering stimuli, which is using the fingers in front of the face, or they'll also have clients tap their finger or their toe, so they're focusing on that while focusing on what they're feeling emotionally and with their bodies. And then the second type of therapy is exposure therapy. This is used to help people face what they find traumatizing in a safe environment so they can learn to cope effectively. And exposure therapy helps people who have a fear of a certain object, activity, situation, or place, so they learn how to not avoid that fear anymore. When people are fearful of that object or situation or place, they tend to avoid it. So exposure therapy is taking those people and step by step making them so they're not as fearful of those certain things. It helps break the pattern of the fear and avoidance. So a therapist will create a safe environment to help them with that. And a couple that we're talking about today is vivo exposure and imaginal exposure. So vivo exposure is when a patient will be confronted directly with the fear. So for example, a woman who has PTSD and was assaulted in a certain location, with the help of her therapist, they'll go back to that location so that woman is directly confronted with that fear to help her get rid of that avoidance. And then with imaginal exposure, this is when a client is asked to imagine feared images or situation, and it helps a person directly confront feared thoughts and memories. It's also useful if it's not safe for a certain person to go directly to that fear. So for example, a combat veteran who has a fear of a combat situation from the war, it's not safe for them to go back to that. So what they'll do is a therapist will have them just think and imagine a certain combat situation to help them get over those fears and the avoidance.
Cognitive behavioral therapy focuses on the relationship among thoughts, feelings, and behaviors. It works to improve functioning in more domains by targeting any one domain. Typically delivered in 12 to 16 sessions and can be done either individually or in group format. Emotional processing therapy is the theory is based on the concept of a fear structure. Fear structure is a type of mental framework for reacting to a threat that includes information about a fear stimulus, about physiological and behavioral responses, and about the meaning of the stimulus and response elements. Emotional processing theory works to counter that by allowing for change in associations that lead to unhealthy functioning in the core of emotional processing. Social cognitive theory involves the incorporation of the person's view of themselves and the world around them in a way that leads to a misconception of the experiences and perceptions of their role in themselves and the environment around them. And the most recent psychotherapy that has been introduced is equine-assisted psychotherapy, which involves a team of 3 working with the client, a licensed therapist, an equine specialist, and a horse. Some programs choose not to have their clients ride horses because they feel that the therapist is the horse, and so riding a therapist is just kind of weird. It also takes away from the eye contact that you have with the horse, which then takes away from that intimacy that you are building. A lot of the horse's emotions and feelings can be seen in their eyes. But if riding is included, it provides a rhythmic pattern, repetitive movement needed to reorganize and heal the brain on a cellular level to help clients learn to self-regulate and to allow them to further recognize relationship patterns and deepen intimacy. It also can help facilitate the processing of trauma. Currently, EGALA is the biggest name in equine-assisted psychotherapy, and it has the model that uses a therapist, a equine specialist, and the horse himself. But it never, it's never without the horse, so you should probably remember that when you're doing it. And the other thing is equine-assisted psychotherapy differs from other treatments because the horse is able to reflect the client through body language and movement, enabling them to reflect back what the client is feeling. It also allows the horse to be honest with the client in a way that maybe a therapist can't, because a horse isn't going to stay where he doesn't want to go, and he will stay with you if he feels comfortable. They are attentive towards you in ways that people aren't. They don't get nearly as distracted if they are trained to do well and with being that mindset, and they will make you actually question things about yourself you wouldn't think of, because they are like the perfect mirror. Some statistics on PTSD is that 70% of Americans, adults, have experienced some form of traumatic event. 20% develop PTSD. There's twice the prevalent rate in women versus men. 71% of female military personnel develop PTSD due to sexual assault within the ranks, and 50% of those with PTSD do not seek treatment.